Why is trauma-informed care vital for disaster survivors? Imagine going through a storm that turns your world upside down. Now think about how that experience can stay with you long after the skies clear. When disaster strikes, it's not just buildings and roads that are affected. People's minds and emotions are deeply impacted too. That's why understanding trauma-informed care is so important for helping survivors heal. Trauma-informed care is a way of providing support that recognizes how trauma can change a person's feelings, thoughts, and reactions. It's not about asking what's wrong with someone, but rather what has happened to them. This approach helps create a safe space where survivors feel understood and respected. When emergency teams and recovery workers use trauma-informed methods, they avoid actions that might make survivors feel worse or re-traumatized. For example, survivors might feel overwhelmed or anxious when asked to fill out complicated forms or follow confusing procedures. Trauma-informed care encourages simplifying these steps and explaining everything clearly. It also involves listening carefully to what survivors need and respecting their choices. This helps build trust and encourages them to participate in their own recovery. In the context of emotional support resources, trauma-informed care means offering counseling or mental health services that are gentle and respectful. It also involves training staff to recognize signs of trauma, like withdrawal or agitation, so they can respond appropriately. When recovery programs include these practices, survivors are more likely to engage with the help available. This increases their chances of healing and moving forward. Trauma-informed care also emphasizes resilience. It focuses on survivors' strengths and supports their ability to recover at their own pace. This approach can include peer support groups or community activities that foster social bonds. These connections are vital for rebuilding trust and a sense of normalcy after a disaster. In practical terms, emergency responders can apply trauma-informed care by being patient, empathetic, and transparent. They can provide clear information about available resources and avoid rushing survivors through processes. Offering emotional support resources alongside material, it helps address both physical and mental needs. Overall, trauma-informed care is essential because it aligns recovery efforts with what survivors truly need. It helps them feel safe, supported, and empowered to rebuild their lives. When we focus on understanding trauma, we create a more compassionate and effective recovery process that benefits individuals and communities alike.